procedure amputable from BSM to ATEM. In today's video, I'll be demonstrating urinary catheterization and removal for female. So first is preparing all the materials needed. And then before touching the patient, I'll be doing a hand hygiene. Okay. Then providing any privacy, good lighting, and then followed by the verification of the patient. Hi mom, my name is Joy and I'm gonna be the nurse student working with you today. So, how are you today mom? Fine. Okay, good. So, I have some questions for you. So, what is your first and last name mom? Okay. Okay, so what is your date of birth, mom? April 24, 2000. Okay, good. I'm just gonna be checking your medical record. Okay, perfect. And let me just make sure that you don't have any allergies. So, do you have any allergies that you know of, mom? No. Okay, no allergies. So, what about allergies to shellfish? No. Or latex products? No. Okay, no. So how about betadine or iodine? No. Okay, great. So let me ask you, mom, when was the last time that you've been urinated? Oh, I think last night. Last night? Okay, so that was a little while ago. What I have is I have an order for urinary catheterization, and what that means is I'm gonna be inserting a tube inside your urethra and it's gonna be sitting in your bladder, and it's going to help drain any urine that you have in there. Okay, mom? Okay. So the procedure should just take a couple of minutes. And do you have any questions for me, mom? Is it gonna hurt? What you might feel is that you might feel a little bit of pressure, but I'm going to walk you through all of the steps and I'm gonna have you take a couple of deep breaths right before insertion in order for you to help with any pressure that you feel. Okay, mom? Yeah. Any other questions, mom? No? Okay, so let's get started. So, assuming that I already put the bed on my working height to avoid any backaches or pain with the patient. So next is I will roll down the blanket. And do the prayer care by using washcloths and warm water. After that, position the patient into dorsal recumbent, their legs on the side with their knees 2 feet apart. Okay, so now let's assume that the patient is already been positioned. Next, prepare the sterile kit. The correct way of opening it is from up, side, and then bottom. Okay, so here, this is the first drape and it is put underneath the patient. inputting, make sure not to touch anything that is not sterile. Then, next drape. So here, it is put around the genitalia of the patient, exposing only the vagina. Okay. So what we have here is we have betadine, but we're not using it. We have alcohol swabs, lubricant spray, sterile water, assuming this is urinary catheter, so here, drainage bag, and semen collection bag. We're not using this right now, okay? Now I'm gonna move my tray right here, and I have here sterile water, and I'm gonna pull back on that in order to break that seal. Okay, so now I'm gonna have the catheter. So I'm gonna open this. And I'm gonna attach it to the balloon port. So assuming this is the catheter, so this area is the balloon port, and this area is for the drainage bag, connection for the drainage bag. So here, if you inflate the sterile water, you can see there's pump forming in here. Okay, so here I'm gonna attach it to the balloon port here, and always remember, do not test that balloon port, just only attach that tightly. Okay, so done. Now I'm gonna have the catheter sit inside the lubricant. So I'm gonna put some lubricant spray, so here, okay, and open these alcohol swabs. Okay, so I have here 3 alcohol swabs. Now with my dominant hand, so here, I'm gonna use my thumbs and fingers in spreading the labia. And with my dominant hand, I'm gonna use this to get the swab. So here, the first swab, apply it away from you. Okay, so get rid of it. Second swab is nearest to you. Get rid of it. Then last swab is in the middle. Get rid of it. Now you're gonna have the insertion. Okay, so Mrs. Attilio, it's now time to insert the catheter. Okay, so here's the catheter. So in inserting, you need to have about 2 to 3 inches. So here, 2 to 3 inches away from the tip of the catheter. Okay, Mrs. Attilio, take some deep breaths for me, okay? Okay, so here. Perfect. Well, I'm gonna be inserting until I see urine. We're gonna go about 2 more inches. Okay, Miss Attilio. Okay, Mrs. Attilio. I see some urine. And you did really good job. At this point, I'm gonna anchor the catheter in place. Okay, and I'm gonna insert the water. Okay, Miss Attilio, I'm gonna insert the water. Okay, you did very well job, Mrs. Attilio. So I'm gonna insert the water. Okay, you did very well job, Mrs. Atilio. So here, now I'm gonna be observing urine on a non-movable part of the bed. And there's a hook in here, okay? And then I'm gonna be attaching the catheter and the stop lock stabilizer right here. So here, assuming that it's the leg of the patient, so I'm gonna have it to stabilize. Okay, so done. Okay, now it's time for the removal. Okay, Mrs. Atilio, it's time for the removal of the catheter. So take a bit difference first, okay? You did a very well job, Mrs. Atilio. Okay, so after the removal of the catheter as ordered by the physician, it's now time to start doing the perineal care. So, same as what I did earlier. So, I'm using the washcloths and warm water. And after giving perineal care to the patient, so I'm gonna remove my gloves. After removing my gloves, wash my hands. So I'm gonna have a hand sanitizer over here. After that, return the patient into a comfortable position. Okay, so now let's assume that the patient is already put in a comfortable position. After putting the patient into a comfortable position, keep all the materials that had been used. Okay? And set aside the materials. Okay? And after that, put the blanket on the patient. Okay, Mrs. Atilio, thank you very much for your cooperation. And I really appreciate it very much. Lastly, record all the findings like the type of catheterization, the amount of urine being removed, the description of the urine like the color, the consistency, and lastly, the reactions of the patient towards the catheterization. Okay, so that's all and thank you very much for watching. Have a nice day everyone. Bye!